Hi, I'm Audrey Herbert. In this section, we'll be discussing the point-of-care ultrasound extended fast scanning protocol. The FAST exam is appropriately named. It is a focused assessment where we're using ultrasound to evaluate a trauma patient for signs of free fluid in the abdomen or the thorax. Free fluid in a trauma patient is assumed to be blood and is used as a marker of injury. The FAST exam does not, however, tell us what injury this may be. It's not going to tell us whether it's a liver laceration, a splenic injury. All it tells us is that there's free fluid in the abdomen or the thorax. And again, in the trauma patient, we presume that that's blood. In this module, we're actually going to be talking about the eFast or the extended fast exam. What the extended fast exam is, in addition to looking for free fluid, we add on 2 anterior lung views looking for signs of pneumothorax in our trauma patients. I highlight the T here because not only do we use this exam in trauma patients, and the vast majority of times you will be using this on trauma patients, but it can also be applied to medical patients. So if you think of patients with a ruptured AAA or patients with a ruptured ectopic, additionally patients with ascites, you can use this exam to look for free fluid, which in the previous 2 examples would be blood, but in patients with liver failure, heart failure, would be ascites. And the FAST exam does not tell us what kind of fluid it is, whether it's ascites or blood. So if you have a patient that has known liver disease and has a trauma, it doesn't mean that that free fluid is necessarily blood. All it tells us is that the fluid is there. There's a lot of literature that supports the extended fast exam in both blunt and penetrating trauma. This exam is going to be very specific in that if you see free fluid in your trauma patients, that likely you have an injury. Again, the FAST exam does not tell you what that injury is. The sensitivity, however, is not as good. You can think that you would have patients with a liver or splenic injury that don't necessarily have free fluid or enough free fluid accumulated yet to make your FAST exam positive. So just because the exam is negative does not mean that there is an injury there. Additionally, this exam does not, again, indicate the necessity to go directly to the OR. So if you have a stable patient with a positive FAST exam, you may end up doing further scans, such as a CAT scan, to find out where that injury is. If your patient is unstable, however, and has a positive FAST exam, that would be an indication for operative management. Here's a slide depicting the probes that you might use. You can see the phased array probe on the left and the curvilinear probe on the right. Either of these probes are appropriate. The phased array probe does have a smaller footprint, so it's going to make imaging between the ribs easier, whereas the curvilinear may be more appropriate in patients with a larger body habitus. So the FAST exam is geared towards finding free fluid present in the abdomen or the thorax. And so the images that we're obtaining are looking at the areas of the abdomen and the lower thorax where fluid in your supine trauma patient will be pulled down by gravity in those dependent areas. So this cartoon shows the different views we're going to be obtaining. You can see the FAST views are depicted in yellow, and then the eFast or the extended FAST views are depicted in white. So you can see with the FAST we're going to be performing a right upper quadrant, a subxiphoid, a left upper quadrant, and 2 views of the pelvis. And for the extended views, we'll be looking at the anterior chest at both the right and left lung. And just quickly as we go through the slides, this kind of cartoon is what I'll use to indicate the probe with the red dot showing you which way you're going to be pointing your indicator to obtain that view. So again, what we're doing in the FAST exam is we're looking for any signs of fluid around the heart within the pericardium, any signs of free fluid within the abdomen, free fluid within the thorax. And then if we do the extended FAST exam, we're going to be looking at the chest for signs of pneumothorax.